All right, we are here today with Lee Vitalee, and I'm Daphne, the owner of IDAF Events, and really excited to talk to you. I've been looking forward to this on the calendar for a while, Lee.
Yeah, me too. Thank you for having me on.
Yeah, I'm a runner, and I've had a bazillion running injuries, unfortunately. And so just being able to talk to you, I think, is going to be really beneficial for a lot of our participants and followers and people that are just curious about what in the world are they feeling? What is this nagging thing that's going on? So today we're going to talk about what some of the most common injuries are that you're seeing right now. We're really going to stick to the runner, right? Through this conversation,
Yeah,
isn't that? Yeah, because
that seems on topic.
we could go all across the board, but we're going to just do running because
I like that. On
yeah.
topic.
Yeah, so we do have triathlons and cycling events, and we really have all abilities and different levels. But today we're just going to stick to running, and maybe we'll come back and talk about one of the other sports sometimes. Yeah, what are some things that you feel like you want to talk about today? Just running stuff? Is there anything else?
I think
Running.
running is good. Seems like the probably the crowd favorite on this podcast, which I
Okay,
think is fitting. So
good. And I did ask some questions from folks to get some input on things that they would like to
oh
know
nice.
about.
Yeah.
So we'll get to those
Pressure is on.
more at the end of the podcast. Yeah. So first off, tell us a little bit about who is Lee and how in the world did you get into this line of work and business?
Oh, that's a very loaded question. That question's always probably changing. PT in general, have a sports background, played sports and played football in college. There's always injuries with that, rehab, that kind of stuff. Really just like working with people though. I remember being like 18 years old and what the heck do I want to do with my life? And I had a lot of good family members that were like, hey, you're good with people, do something with people. And my mom was like, I think you would be interested in physical therapy. So I looked into that and then did a lot of working out, running, sport specific stuff. And I was like, wow, that really fits a lot of the stuff that I really enjoy and am passionate about. That's really what got me into it. So it really feels like PT is sometimes not work because I get to do the stuff I really enjoy to do.
And it's probably natural for you too, because
Yeah,
you
I think so. It feels
found
pretty
it so much.
natural.
Yeah.
Yeah, I've my wife has been like, yeah, I don't really see you doing anything other than that. So that's
Yeah.
probably a good sign.
And when I met you, how was it, a year, 2 years ago? I don't
It's
know.
probably been a year and a half or
Okay.
so.
Yeah, we met. I was dealing with a running injury, and you just seemed to just hop right in and be like, yep, I know exactly what that is, which was really great because you definitely had this confidence about you that you could help mend it and get it figured out and fixed. So,
Yeah,
yeah.
most of the injuries I see, I have experienced something like that or the same thing at some point in my life or career. And I always try to, I think, tailor my approach to what has worked for me and then like how does this felt and how does this limit. So a lot of the training I've had plus personal experience, I think, has evolved into the way I
Yeah.
practice, which hopefully is a good thing.
Yeah. One of the other things, and I've been to other physical therapists before in PT organizations and
Yeah.
stuff. One of the other things, just really quick, that I thought was cool about you is that you have the app that you can send the exercises and do the check-in and stuff, right?
Yeah, the biggest. So that was, I got into PT for all those reasons. And I was really, honestly, I always hate sounding negative, but really my first year and a half in the profession, I was honestly kind of disappointed with just I think the general way that we did it. And I really felt like a lot of the practice was see people really frequently. It seemed really fill the schedule, get people in. You're trying to
Yeah.
hit a number quota. So I was like, is this the way I want to do it or not? And basically, I sat down and I was like, all right, the options are do something different or go do it the way you think it should be done. And I've chosen the second option. And really, my whole practice and philosophy and goal is to get people in and out of PT really as quickly as possible in as few visits as we can, which that sounds really simple, but sometimes people are like, that's crazy because that's maybe cuts into your
Yeah.
bottom dollar. But what I have seen is that it does the opposite. When you get people better and do the right thing quickly and don't waste people's time and money, you get other people because of that. So yeah, that's really the approach I've taken. And it's really trying to get people to learn and understand what to do on their own, where they're not reliant on coming into physical therapy consistently over and over again. And that's really how I practice for not just runners or athletes, but even older adults or people that are post-op. The whole goal is we're building a plan that takes you from point A to point B, getting you back to what you love to do.
Yeah. Yeah. And the thing is, we're so busy, right? It's like we're juggling families and kids and sports and our own exercise and work and all the things. And it's like sometimes you just can't fit an hour PT session to go
Yeah.
somewhere, drive down
Yeah.
26, heaven forbid, to get,
You're
to
right.
get there.
Yeah.
And it's, yeah, I think that you have to think outside the box a little bit. And yes, sometimes I think you do need to definitely come in and make sure that you're doing it correctly and that sort of thing. But it sounds like you've really come up with a way to make it more accessible and convenient for people.
Yeah, that's definitely the goal. Another thing is when you're talking about working with a runner like yourself, or even someone, maybe they're not a runner, they're a CrossFit athlete or person that's playing a lot of sports. If you're doing physical therapy the right way, their prognosis and recovery time should be a lot faster. So I'm okay, if I do the right stuff, this person should see some change in like 2 or 3 weeks versus I think the traditional model a lot of times is like, hey, let's try PT a couple times a week or once a week for 8 weeks, but really try to hone in on, hey, if this person, if we're doing the right stuff, we should see pretty quick changes and know if we're doing the right thing or not.
Yeah. Cool.
And yeah, and I'm like, if someone told me to do PT 3 times a week, I'd be like, yeah, I don't really think I have time for that.
Yeah. When am I going to fit that in?
Yeah. All right.
At night, you just want to sit and do nothing sometimes. And it's
Yeah.
like,
Sometimes you need to do that.
stuff.
Yeah. Sometimes you need that recovery. It's important.
Yeah. So, like I said, I've had all the injuries. I think all the injuries, I'm exaggerating, of course, but I've had a lot of running injuries. And I remember specifically the first one that I got, which was 20 years ago. I started running and just knew nothing about it, just started running, and then I ran every day and just ran fast, ran hard, like just whatever. I didn't know anything about it. And I remember I got a groin pull. A severe groin pull was what it was called. And it was, I did way too much mileage too quickly. I was running fast and probably turned incorrectly, whatever. So when I had this injury, Lee, I was like, what is this? I have not fallen.
Yeah.
What is going on here? I didn't even know you could get a running injury from just running.
Yeah. No traumatic event.
Yeah, like I didn't trip on a trail. I just was running and got this injury. Doesn't that seem strange to you?
Yeah, it's funny because those are the cases that honestly are the most worrisome because you exactly what you said. You're essentially, I did not do anything that makes sense why this should feel this way. I do not understand. And then you can go the Dr. Google route or think of all these different things that could be going on. And it freaks you out. But yeah, I mean, it's really common. I hate's a strong word, but I don't like the whole like overuse thing. I think in your example, it was more so, hey, I didn't have the best training program or kind of thing to follow. It wasn't necessarily that maybe you were just like running too much, more so the volume at certain times or under recovery. And I think that plays adamant to, it's good that there's a lot of resources out there now that have programming and even a lot of the general apps and things like that have really good places to start with the base from. But that's very common that people say that, hey, I just started running or this or this. And then they're like, why the heck is this going on?
And what I found out through the years is it's because of the impact, right? It's different than other sports too, like cycling, where you don't have that high impact. And so your lower extremities especially are just feeling bang, especially if you're a pavement runner, which that's what I am.
Yeah, I think that really goes into the philosophy where if you have like having not perfect or not the most technique may not be a big deal. You're getting into that higher volume of mileage, the kind of the wear and tear without maybe the right running technique or best form, that starts to really add up because not only is it there's high impact, it's pretty much repetitive, the same thing over and over again. And what we know in fitness world or PT world, even if you're doing something that's low load but very repetitive. If something is even just off by a small margin, that adds up. And over time, you're probably going to end up with that out of the blue. The heck did this happen? That's a really common presentation of how did you get to this point of what we'll call injury.
Yeah. As we put on races and you come to a lot of our events and set up. And for me as a race director, I see how much time and energy and commitment people put into the goal of getting to the start line and then getting to the finish line at a race. There's so many sacrifices that people make along the way, and it can be so frustrating when you are on your way to that goal and then something comes up like a running injury and it sidelines you. And I think that's one of the reasons I want to talk to you, is just to give people hope that you will get better, because sometimes things last for a long time. I've been dealing with a tendonitis issue for a long time. I think that maybe if we just talk about what some of those running injuries are and the prognosis of that, I think that might help. Tell me a little bit about what some of those injuries are that you're seeing like over the last 6 months to a year, especially.
Okay. Yeah, I've actually not been seeing quite as much of the adductor growing, but that definitely is in there. The most common one that comes to mind, and I can go back through my data, is we'll say anterior knee pain. So essentially knee hurts, painful in the front. Diagnosis could include like Osgood-Schlatter, jumper's knee. It's really commonly patella tendonitis. And essentially with that, a lot of times you're going to see, similar to what you said, there may be this repetitive thing you're doing with your training, or maybe you're missing something, but essentially overtrain, quad becomes injured, strained, that causes the muscle to actually get weak, and that actually causes it to get tight, which actually causes the patella to then get tight and to pull on the insertion point in the tibia, which is right below the knee. And then that's when the brain says, hey, this hurt and does not feel good. And really the big thing with that, and like with the injury you mentioned too, it's important to get in quickly. My rule for people is, hey, if you have this issue that flares up, give it like 1 to 2 days, maybe just take some time to rest and recover. And if it goes away, hey, no big deal. Probably just like minor strain. Your body's saying you pushed a little bit too much, you need to recover more, no big deal. If it hangs around really longer than, that's where I would say go see medical professional or someone in your corner that you can trust with like sports injury. And then what we know from a prognosis standpoint, the quicker you start getting treatment or intervention for it, you're going to get over that injury faster. Specifically for tendon injuries, it's the chronicity of it, where if you're hanging around with tendon pain for a long time, it actually makes it harder to get better, because that muscle group again is weak and tight, and it's just getting more and more atrophied. And what happens in healthy people, because you're so healthy and fit, you basically compensate with other muscle groups, and you're like, yeah, this is fine. I can run and get away with it. No big deal. And this little snowball is slowly in the shadows building up, and you get a problem down the road and you're like, wow, where did this come from and where did it happen? And that's what I really see with people, is that's what's going to change the prognosis, is really your time from injury to your time of starting to get treatment for it and starting to get it better.
Yeah. So is the knee pain that you're talking about, is that runner's knee? What they call
that'd be the same diagnoses. The problem in Western medicine, sometimes we give all these cool names, and it's kind of cool. What does that mean? Who knows? A lot of times they present pretty similar. Essentially, if you're getting, in this case, what we're talking about, knee pain in the front along the bony part of the kneecap, whether it's above or right below, fits into that category. And if you look at really evidence-based physical therapy, what's the best course of action for it? It's actually strengthening the quad, which can sound weird because a lot of times people are thinking it got hurt from doing something active. It seems like it would make it worse to do more on it. But you're essentially doing more of what you should be doing, is more of a type 2 kind of anaerobic stimulus for it, which is going to be a little bit different than your distance training regimen.
I don't understand that terminology.
I'm trying to sound really smart. So basically, distance running, you're going to be working.
Types. You have all this lingo.
we try to sound fancy. With distance running, you're doing more endurance-based exercise. So what the data really shows is, and what I think a lot of people know, cross training is really important where you're getting a different stimulus. So a lot of times to get an injury better or to prevent it, you want to do some cross training basically for that muscle group. And in this case, for a distance runner, it's going to be some type of resisted strength training load. And we won't go too much into physiology, but you have type 1, type 2 muscle fiber. There's also a intermediate, but in running, you're mostly using the type 1. So there's some thought if you aren't getting as much anaerobic type 2 muscle fiber development, that system weakens. But really simply put, you just want to do kind of a different stimulus that strengthens the quad in a less repetitive, impactful way, target the muscle group that you're going to use when you run.
So I had that injury a long time ago. And the person that I saw at the time told me to take up biking, that I needed to bike, get on my bike and build up my quads. So I did. So got rid
Did it
of
get
that
better?
injury. Yes.
Nice. Yeah. Hey, score 1 for us.
Yeah, but there's other stuff involved too. But that was basically like, instead of just running, add cycling in to help build up those muscles.
Yeah, I think the most common thing I see is people, their first thought is to stretch, which makes sense because, at least from like a logical standpoint, because a lot of times with those types of injuries, it feels like there's tightness around it. And I think the important thing for you guys listening to realize is that tightness a lot of times is more of a symptom, and it's coming from somewhere else. And in this case, a lot of times it's the root cause of muscular weakness. If you just stretch it or try to stretch it to get over it, you're going to be treating the symptom. Whereas like in your case, when you started biking, you started doing quad dominant strength training in a non-painful environment or stimulus that basically broke the cycle of the root cause where the muscle group was weak and causing the tightness. Yeah. So you want to get to the root cause, and a lot of times it is the muscle weakness, which can sound weird.
Yeah. What else? So what's the next one? What's that?
Probably sticking with the knee. This is one that always gets me when I ramp up my running volume, or even if or backpack more specifically, but lateral knee pain. So we're going to the outer part of the knee. Outside part, common diagnoses is going to be, hey, you have IT band syndrome. And essentially when you run, you're going to get this kind of dull, achy pain outer part of the knee in that bony area. When I have experienced it, I normally don't feel it as much with running. It's more so when my running volume goes up and then I'm doing squatting and other things and I'm getting into deeper squats and I start getting this stabbing knee pain in my outer part of the knee. And normally my mind goes to, oh, my hip abductors are probably, something's happened there, not doing enough stuff, and essentially go the strengthening route there. But going on my own example, similar story. I think I was training for the Blue Ridge relay, which is, what's the common term for that? Like a not Nordic relay, essentially where you go like 24 hours and you take turns and you sleep in a van, and it's supposed to be a lot of fun, but it ends up being a little bit miserable. But I was training for that. And this was actually when I was in physical therapy school pretty early on. And I got this lateral knee pain. And just like your story, I was like, what the heck? Where did this come from? No traumatic issue or injury. And I saw a couple PTs for it that I think probably went more of the biomechanics, looking at more like structural things. And essentially it got better when I started doing hip abductor closed chain single leg strength training, which was weird because in my mind I was doing a lot of running and CrossFit at the time, and I was like, I'm doing a lot of strength training. It's weird that I need to do more, but I needed a specific stimulus that was similar to running, which is single leg. Most of running, you're spending either in the air if you're running correctly, or you're in single leg. So if you have weakness in your hip abductors, which is this nice muscle group on the outer part of your hip, you may be having a problem there if you're essentially getting lateral knee pain, which is a weird one because the pain is in the knee, but a lot of times the issue is actually coming from somewhere above in the hip. Potentially.
So like when I've had IT band issues as well. So when I've gone to get massages, they always just rake on that.
Yeah.
Is that good for it, or is that?
Yeah, it's not a bad treatment at all. Going back to and this really fits into my story as well, going back to that kind of physiology where if you have that muscle tightness or that trigger point, really tells you there's a muscle weakness there. A tight muscle is a weak muscle. So like in the past, when I was struggling with it, I was doing that kind of, and it would get a little better and it would still be this cycle of like little better, worse, little better, worse. And it was really adding the specific strengthening that broke the chain. But to the massage therapist's credit or a PT's credit, that's going to do soft tissue massage or something like even dry needling. Sometimes you need that hands-on intervention to get you out of the pain threshold. So in that case, like if you're having so much knee pain, you can't do strength training or running, you may need the massage or the dry needling treatment acutely just to get you out of it, where then you can strengthen the muscle group back.
Roller, right?
Or foam roller. Yeah, you can go that route too. I would just caution you, if you're only doing the foam roller or the massage or the acupuncture or the dry needling, you're really just treating the symptoms, and you're probably going to be in that cycle for a long time where it gets better, gets worse, gets better. And sometimes that's where, you know, you will see a PT plan of care take 8 to 12 weeks because you're focusing on that kind of stuff rather than working towards the strength training stuff, which essentially you can do on your own as well. And that gets you hopefully better.
Yeah. All right. So we've talked about the knees. Top 2 were knees. What's the next one? What's the next injury?
Actually, recently been a lot of medial inner arch foot issues. So this could be, you're probably noticing I'm calling most of the problems like foot pain or knee pain because it's much more simple than to give it a diagnosis like plantar fasciitis or something like that, or Achilles tendonitis. But yeah, I would say most recently, the biggest one I'm seeing is, we'll just say, running related foot pain, whether it be on the inner arch or the heel. And that one's gonna be a little bit tough treatment wise because it can be hard to stay off your feet and not aggravate. But the treatment a lot of times is going to look similar, where it's basically find where it's coming from, hopefully from a muscle group, treat the muscle group. Again, it may be soft tissue work, it may be dry needling, it may be something as simple as, hey, Daphne, start foam rolling this muscle group, get pain level down, and then start strengthening the muscle group that is contributing to the problem. The other side is, if someone's having foot issues, I'm typically more likely to look at maybe running mechanics at that point, or screening the hip just to see if there's something else playing in. Sometimes it's not always a strength imbalance. Sometimes people end up in that scenario because there is something technical going wrong. But yeah, I'd say the big next group is going to be foot pain, whether you're plantar fasciitis or posterior tib tendon pain or Achilles tendonitis.
Or neuroma. I've had one of those.
Or neuroma. Yeah, that's that. If someone has a neuroma, that's probably one of the hardest ones, because you're dealing with something less truly, which is always more challenging.
Tell everybody what a neuroma is in case
it's essentially where you're getting a nodule in part of, we're just gonna say, the nervous system or peripheral nerve, and like especially the foot. It's really common between, I can't remember exactly which toes. Maybe it's the first and second or third. Third and fourth sounds more accurate. I haven't seen a lot of neuromas lately, which is good. But yeah, very painful. You're getting a lot of times nerve symptoms. And as a PT, when people present with just like classic traditional muscle pain, I'm like, heck yeah, we can fix that. That's super easy. Whenever they start presenting with something nerve or more mechanical or structural, that's where it gets a lot more challenging. And prognosis not as good.
Yeah, I got my neuroma because I would run during my lunch break, and then I would go and put on my fancy tight closed shoes. And so once we figured that out, I stopped wearing that type of shoe and got my foot all fixed up. But you a
big fan of the wide toe box?
Yes.
Same. I've been even just recently, I've been working a lot of hours and on my feet a lot, and I'm like, oh, I have some non-wide toe box shoes, and I'm about to go all wide toe box because of that.
Yeah. When you feel that little electricity zing when you step down,
that'll make you switch shoes on it.
No. This isn't gonna work. Okay. All right. So we talked about Achilles heel pain. What's the next one?
Those are the big ones.
The
Then I would
game.
come back and go more with the adductor injury. And it's always interesting, especially with females. And this is where it's good. I'm not a pelvic floor specialist, but there are PTs, great PTs out there that specialize in that. And
Yeah.
it's not uncommon for people, whether they're runners or not, to have adductor or growing injury. And it truly be that, or it could be something pelvic floor related, which is common runners too. But to be simple, that's going to be
Yeah.
that inner upper leg kind of
Especially after having babies.
pain. Yeah, exactly. There's definitely some things that have changed and gone on, which is necessary, but it definitely can have a big impact.
Yeah, big time. Awesome. So if somebody's feeling some of these things, I would recommend personally, don't go to YouTube and look up videos on how to take yourself, because
I knew I liked you for a reason.
I did that recently, and I must tell you that I couldn't walk that night because I didn't put the tape. I thought I knew what I was doing, but I didn't really know what I was doing. I love tape. I don't know. It's just like this weird thing. I feel like it's a little security blanket. If I have a little nagging thing, I'm like, I'll just throw some tape on that, some K-tape.
Yeah.
But you need to know how to put it on, because there is an art to it, and there's different types of tape and all that. So you do that too, right? Like you can tape people.
Yeah, some PTs take specialty courses in that. I haven't done any like specialty courses with that, but essentially if you're someone that knows your anatomy and you have like an AT background, you can normally do pretty good work with tape too. But yeah, sometimes the Dr. Googles and Dr. YouTubes are not always the best route to go. Sometimes they work great, but sometimes they don't.
Yeah.
Flipping a coin. Sometimes you go to a PT or doctor or whoever, and you may get mixed reviews. It really just depends. I think it's important to have trustworthy PT, chiro, orthopedist, DO. I mean, someone that speaks the language and that you trust their opinion. I think in the physical therapy world, we'll say the money is really in the evaluation. If something's going on, you really want to know where's the problem coming from. And then, like we've discussed, some of the strategies to help fix it, or even watch YouTube and get some information and then take that to your trusted provider and see if that's, like, are you on the right track, or is that maybe not the best idea? Because everybody is different, which is good.
Yeah.
Keep things interesting.
No, too, I've had injuries. You just get fed up with it and you get impatient. Like you just want to be running tomorrow, right?
Yeah.
So you want to get fixed really fast and back on the road and all of those things. And for me, I'm super proactive when it comes to that stuff. But sometimes, like you said, people wait and they don't get checked out and get help. What advice do you have for people that, are just on the fence about coming to PT?
Definitely do your research ahead of time. I have people that have asked me, like, how do you find a good physical therapist? And it can be challenging because there is always the business side in healthcare where there are places that it just depends where you go, essentially. But I would say what you do is go online, read about it, look at reviews. The easiest thing to do is call somewhere and just be very general and vague and just simply ask, how many times a week do people normally do physical therapy? Don't tell them anything other than that. Just that's the simple question. And if they're like, everyone does 3 times a week for 6 or 8 weeks, you probably want to call a different place because you're more going into cookie cutter. Exactly. Yeah. Or if you ask, the other thing is to ask if you're going to always be one-on-one with your physical therapist. There are a lot of places, depending on insurance business model, you may not be. And then for that question, first question, hey, how many times a week do people typically do? Get your answer and then ask, am I always one-on-one with my physical therapist? And if they say anything other than yes, your top choice, unless you're desperate.
I totally agree with that.
Yeah. Not to say those places are terrible, but there's great PTs everywhere. I think it's really the system. You have to be careful about the system you're choosing that you go to.
It's the business model. And I think if you want the attention that you deserve, it pay to do a little research. Yeah.
I mean, I think it's always good. I'm odd and really weird and love talking about health insurance and co-pays and monetary things, but sometimes you can go to a out-of-network, cash-based, self-pay physical therapist, and actually they may charge a lot more than your insurance covers. but you may actually get better faster and do less visits. And in the long run, it saves you a lot of time
Yeah.
and money. And there's always, I always look at it. I grew up in this area, and I don't know, weird, but I'm always wondering about the financial stuff, which I think as healthcare providers, I think you honestly have to, because again, you're talking about making PT accessible or not. And for some people, even with health insurance, you go to physical therapy, you've not met your deductible, or you don't have good
Yeah.
insurance. If you're paying $90 a session or even 70, and they're saying, hey, you need to do 8 to 12 visits, that wouldn't be affordable for me. I'd be like,
Yeah.
I think I'll go
Yeah.
to YouTube and see
Yeah.
what happens.
Assume because they have PT coverage with insurance, that's the best deal financially, but it's not necessarily. And
Yeah, not
I've
necessarily. It
experienced that
depends.
myself. It's definitely you're hooked into this set number of things, like you said, and this is the cost. And if you run the numbers and you come and see you 3 times versus
Yeah.
like,
Yeah.
okay.
Really, in my business model, essentially, we're trying to offer the best quality care possible, but there's always the thing where trying to compete with insurance and trying to give people the best price for the quality, where it's hopefully you don't have to worry about, all right, insurance is this, place is this. But yeah, anytime, the biggest thing is find who's going to get you better quickly, and there's a clear defined plan. You're here, this is how we get to here, this is our time frame, and ask a lot of questions.
Yeah. Okay.
I like hard questions, put people on the spot.
Yeah, that's good advice. I know we've been talking for a bit, and we did have some questions that came in that I just want to ask. We don't have to spend a ton of time on them, but I thought they were good ones.
All right, pressure's on.
What's the best thing to do for sore muscles? I don't have a bathtub, which means I can't soak in Epsom salts.
Oh. If you're getting sore, that's good. You're doing good stuff. I would say sleep is very important for recovery. I think that's very underutilized and talked about. I really don't believe in hardcore you're overtraining. I more so believe in under recovery, which is probably a cliche to say. But on days you're really sore, do a light workout, but do it more so just to get the heart rate up and get blood flow pumping. You're not trying to push and do
Like
something
instead
really
of running,
strenuous.
maybe try swimming or bike.
Yeah,
or
cross train,
yeah.
hit a yoga session, mobility session. Even at that point, something that's more relaxed, almost even meditative.
Yeah.
I'm a big fan, not that it always is worked or proven in research, but nothing beats getting in the Davidson River every now and then. Yeah.
I didn't think about that. That's a great suggestion.
Yeah,
Put your
I
legs in
like
there
the
and
cold stuff.
plunge.
Yeah. If that works for you. I don't have solid research that just says, hey, go do that. There's not a
Mhm.
ton that says that's clearly defined to improve recovery and performance. It may only be like a percentage point or two, but it's really finding what makes
Yeah.
you feel better. It's specific.
Yeah. Okay. All right. Next question. Is there a specific time frame after an injury to hold off on running? Or do you just start back when it feels better? Like, how do you know it's okay?
Oh, that's a great question. I try to guide my clients, patients, runners, you want to call them, with almost more being intuitive, where essentially, let's say you have knee pain. Hey, when you normally run at the 5-minute mark, you're getting knee pain. Okay, we need to basically stop the exacerbation of symptoms. So we're going to pull your running down less than 5 minutes, do some interventions, probably give you some strength training stuff. And essentially, if you can still run for a minute to 4 minutes, it's good to continue your running. And then basically from there, it's let's reintroduce you to that stimulus. And if you can essentially run with even just, we'll say, mild or very dull symptoms below 4 out of 10, probably fine, as long as you're not continuing to run and those symptoms are worsening, or day after next day your symptoms have come back. I think the simple answer is you can keep running to the point of symptom exacerbation, but you should also be cognizant not to over push. Hope that answers that.
So my tendonitis after about a mile of running just goes numb in that area. Yeah. It's great.
Hello, baby.
It's the one I stopped and I'm like, oh, Yeah.
Yeah.
So I think sometimes it's like you don't really know until you're done
Yeah,
necessarily.
that's a tough one. I mean, it really depends on the scenario, but it's really guiding your return to running with symptom management, I think is the simple
Yeah.
answer.
Yeah.
That may
And
not be the best
do
answer,
that.
but
Yeah. All right. Next one. Who has battled with plantar fasciitis? Is that the right way to say that? Fasciitis.
you can say it
Um,
however you want.
tips and exercises for that.
I'll give the when I was
Short.
in Pete, there's always the it depends answer. Again, you want to break pain cycle, the stimulus. A lot of the research shows like night splint bracing, if it's truly plantar fasciitis, is good. Sometimes changing footwear or shoe wear. Plantar fascia pain or that presentation of pain can be truly coming from the plantar fascia or foot, we'll say intrinsic stabilizing little muscles in the arch of the foot. It could also be referring from your gastrocsoleus muscle group above, or even somewhat coming from the Achilles. So in that case, it's really figuring out which muscle group is it coming from, and then basically trying to get the muscles relaxed. And then really the general answer is going to be building them back up
Yeah.
with
Strength.
strength. The biggest thing my kind of thing with almost everything is if you have pain and muscle tightness or issues, you probably have a muscle weakness and imbalance somewhere. It's just a matter of finding where it is.
And you help do that, right? You help figure out what that muscle imbalance is, where it's coming.
Hopefully, yeah.
Yeah. Yeah.
I should.
Yeah. All right. How about running in cold weather? Like trying to get your muscles warmed up and ready to go. Like any suggestions on just keeping those muscles warm and stuff when it's super duper cold and you're running? Yeah.
Definitely a really good active warm up, maybe even an active dynamic warm up. Not necessarily, and I'll preface that and say active dynamic warm up is going to be you're doing like almost like running specific drills or compound movements, not necessarily static stretching, but maybe do that in a warm place and then transit and get really warmed up and transition it to outside. What you wear is important too.
Yeah.
And I think the hardest thing with running, your upper extremities get cold because you're mostly using your legs. So your blood flow by default is going to go to those muscle groups. I think like wearing stuff on your hands and those extremities in the upper body that aren't going to be as warm. Definitely keeping your head is where your warm air escapes from. So definitely prioritizing. I know when I run in the cold, I don't like to get all, if you're bundled up and restricted in your upper body, that's really challenging. Definitely go with good headwear because that's easy to take off, get rid of, or on top of that, it's a lot less weight for what it's accomplishing. I think a cool side note, not necessarily answering this question, but they've done research on this. I think it was runners, but they had runners basically train. Some of them trained in a moderate temperature environment, and some of them trained in a really hot temperature environment, and then they competed in a more of a cold temperature environment. And basically, the runners that trained in the heat did even better in the cold because essentially, when you're training in the heat, your blood supply is in battle for getting blood flow to the muscle groups, getting it to the skin to cool down. So even if you're doing like a winter run, if you can train in the heat or go somewhere hot and train hot, yeah, exactly. Then that's actually going to be beneficial from a performance standpoint.
That's good to know. I like that.
Good side note.
That's a little tidbit. I like that intel. Hope everybody heard that. All right. And then the last question, if you start to feel some pain running, should you push through it? Should you stop immediately? I think this sort of ties back into what you were saying before, but any advice on that if you just all of a sudden feel something?
I think it's identifying the stimulus of pain or sensation. So is it more like sharp stabbing, high intensity above, we'll say 5 out of 10? If that's the case, I would say yes, stop. If you're getting more dull, kind of ache below 5 out of 10, you're probably getting more muscle feedback. That's probably saying, hey, Lee, hey, Daphne, we're tired now. Please slow down. If you're getting that type of pain, totally fine to push through. If it's the sharp stabby, back off.
Yeah. Yeah. And all of our races, we always have water stations and medical crew and stuff like that. Trust me, it is not worth pushing through something that's a stabbing 10
Yeah.
because it will take months and months and
Live
months
to run another day.
to get it back to where it needs to be so you can run
Yeah.
again.
And you'll come back stronger if you do the right stuff.
Yeah.
Your
Yeah.
performance will probably be better.
Exactly. So what else? That's the questions we had. What else do you want to share with folks? I know you had put some literature and some research.
Oh, yeah. I think we've talked about it a lot. If you're probably tired of me saying, get it stronger, do some strength training. But even from a performance standpoint, I shared this article with you. They took elite distance and mid-distance runners that were not doing strength training and essentially had them do 2 to 3 times a week squats, plyometrics. I thought it was really fascinating. Sprint interval work. And essentially what they found was that actually improved running economy would be the fancy word, but it essentially improved their running performance. And what's really cool about that is happening in highly trained elite runners. So if you're kind of couched to 5K or kind of a recreational runner looking to boost your performance and you've not done strength training before, if you prioritize 2 to 3 times a week of that, you're probably going to see pretty substantial benefits to your running. And in theory, maybe prevent injuries and things like that.
Yeah. Or if you're just a cardio endurance junkie and you don't like going to the gym.
Yeah.
Then if you make that a priority, it does make a difference. It really does. Like I've been doing it religiously since this past summer. It was hit or miss before for me with strength training, but even when I run, I'm like, my legs feel strong. And I always thought, well, my legs would be strong because I run, but adding that extra strength element.
Different stimulus. Yeah. I think it's important to find what you enjoy. I will run a 10K. Getting above that, that just sounds torturous. Like my running regimen, I love to go do like sprint intervals. I'm weird and have like track spikes and like to do sprints and that kind of stuff. Yeah, but as a distance runner, if you're a distance runner, you like running. If you just even mix in sprint work and speed work like that, short, fast running, you're going to get a strength stimulus from that. So you don't have to go to the gym. I think sometimes the gym can be boring for some people.
Now, a question because I'm curious. One time when I had an injury, I went to a PT. No, I think he was a sports medicine doctor actually. And he told me I just needed to stop running.
Probably not the answer you were looking for.
You don't tell people that, do you, Lee?
No. No, of course not. Definitely no. No, I think
that you need to stop running.
Yeah, if that's your thing, you can't. It's like telling a fish not to swim. You're not going to get a good outcome with that. There's going to be scenarios where maybe you should take time off and do some other stuff, or in a very extreme scenario, sure, stop running. But I can't really say in the years I've been doing this, I've just bluntly told someone like, you can't do this. I think a lot of being able to do something or not comes down to the person, whether you want to do it or not. You can be creative and figure out ways to do it.
Yeah. For me, it was doing different exercises, not just running. So adding in biking, swimming, yoga.
Yeah.
That helps. And it's, man, if I could just run every day, I would, but my body doesn't put up with that. And I would say a lot of people's bodies don't. So I think it's that trick of cross training that really helps you to be able to do the things that you love to do for a long period of time.
Yeah. That's what's cool with, I think, triathlons too. It's essentially a cross training event. Yeah. It's very endurance, but.
Yeah. Great. That's wonderful information. I think you covered some really good stuff. And how do people find you if they want to talk to you or connect with you? What's the best way to do that, Lee?
If you go, it's maybe hard to spell. My website, vitaleept.com, essentially vital, VITALEPT.com. Information on there, phone numbers on there, email is on there. Have people ask questions, again, as you should before you go to PT. Try to make it really easy, streamlined. You can self-schedule online, pulls up the calendar, click a button, sends you intake. Yeah. So try to keep it as easy as possible. But yeah, all my information is online. I'll be setting up at when is the Asheville Marathon? March. The
March.
date is
March 18th, Asheville
18th.
Marathon and half. And if you hear this after that, you're at quite a few other events throughout the year we put on to the finish line or at our expos. You can stop in and visit with Lee. And
yeah, I would say too, I get people sometimes that call me that have PT, or I'll get people that are like, hey, I want to go to physical therapy. My copay is $20. I see you don't take insurance and your rate is a little bit more than that. I get people that ask that sometimes, and I'm happy to say, hey, try this clinic if you want to use your insurance. I don't just bluntly turn people away.
Yeah.
I try to get people in the right spot. I think as for our profession, it's cool if you hopefully do PT and get a good outcome.
Yeah, that's the goal, right?
That's the goal. That's the goal, baby.
All right. Awesome. Thank you, Lee. I appreciate you and all this wealth of information you provided, and we'll see you soon.
I appreciate it. Thank you for having me on.
Thanks.
Thank you.